So this is how you cold roll a cone. First of all, it's very important that we get a nice clean glass slab. So make sure you have no moisture on either side of the slab that you're going to be using to roll the cone. It's very important because otherwise the cone will slide around. You then take the cone that you want to adapt. Let's say, for example, it's this particular cone here. This one happens to be a 25. Doesn't really matter what cone you manufacture or what shape it's in. All you know is that, for example, in this case, it might be binding a little bit more coronally than you would like, and you need to sort of modify the shape. What you do is you take the upper glass slab, you put it on top, and you roll it very carefully. What you want to do is you want to modify the shape in a place that requires alteration of the taper. So we want, for example, if we want to modify this section here, we roll it a little bit harder in the more coronal portion. Takes a little bit of practice, and you'll notice that the cone will start to lengthen out. Therefore, you can modify the cone according to the shape of the canal. So when we're done, instead of having a normal cone, which looks something like this, we now have a cone that's just slightly longer and perhaps a little bit more tapered. And you can work with this cone until you get the kind of shape that you want. The idea is to apply pressure. It takes a little practice to be able to get this right. But when you've got it right, you now have a cone that's not really standard, but you have adapted this to the size of the canal that you've prepared. That's one way. Another way, sometimes cones aren't shaped the way we want. This is a really good example. Large cone. We want to, for example, work on an immature tooth. So again, we want to roll this down. Takes a bit of doing to get it started. Again, pressure with your finger right over the top of it. It's going to roll around a little bit. Idea is to try to get it smooth. So, and don't end up with the flat side. If you have problems with one cone, throw it out and use another one. I say it takes a little bit of practice to do this. Sometimes you want to use a side-to-side motion. The idea is that you're getting a nice, smooth surface. Case like this, for example, we've got an immature tooth rolling up on top, and then at that point, we would use scissors to cut the cone, for example, to the size of the canal that you need. So it would be a very simple matter of taking a pair of scissors, or some of us like to use gauges, and you can cut the cone to where you need it. So now you have a cone that's of the appropriate size for the canal. Last way to modify cones is sometimes we have a tooth that's really, really long, and there's just not enough length, even if we roll it down. So what we can do is we can use a torch. So what we do is we turn on the torch, get a flame going, and we can take a couple of these cones. Instead of using just one cone, we take two cones, very gently run them through the flame. What you're doing is you're warming up the Gutta Percha. And again, you use a rolling method. And with the heat, you've now created a much longer cone. Well, those really, really long cuspids and those really long teeth that requires some extra length. I don't much worry about all these little fins and everything because they're going to be taken care of once we do a warm vertical obturation technique. That will solve that problem. So I hope this video has helped you with the cold rolling technique. One last thing that we can do is we can use another technique when we have a long canal and we find that the appropriate sized paper points don't work as well as we'd like because you're bottoming out the point. Put the paper point in the canal, it goes all the way in past the access. So you lose control. You're going to start to fish out the paper point from the canal. So how do we deal with that? We deal with that by using a little bit different technique and modifying our endodontic files.